Patients with special needs are patients with special challenges. Nowadays, technology has been an advantage to allow our patients to leave the hospital and then to convalesce at home. So these patients are now leaving our care centers and going to the home place with advanced technology to sustain their life. A lot of times they're on venting systems. They also may have suction devices. They may also have internal indwelling catheters that are used for administration of nutrients as well as IV medications and blood products. So let's talk about a little bit about ventilators and ventilator settings. So some patients may end up going home where they have some type of breathing device that's permanently placed within the tracheal or windpipe area. These are trach tubes, and sometimes because they're cannulated as such, there is chance for mucus and mucus plugs to obstruct this airway device, making it difficult for the patient to breathe and therefore even to ventilate. We may get called for that. A lot of times these devices are then attached and connected to the vent settings, and sometimes the ventilator itself may not be working. In any event, when we get there, we're going to try to troubleshoot this. So we would go ahead and detach their ventilator and then try to assess from our side with a bag valve mask device, positive pressure device, to try to ventilate through this. If we're having issues with ventilating through this, we may end up asking to see if they have, or we would try to get our suction device and then use a not a rigid tip catheter, but more of a suction tip catheter to clear this out and then try to reventilate. If for some reason this becomes dislodged, then we're going to have to decide to ventilate through the mouth and nose and obstruct the ostomy, or are we going to close the mouth and nose and ventilate through the ostomy itself? And in some cases, our paramedics may introduce into a cuffed ET tube or endotracheal tube into the opening. Other patients may be at home with long-dwelling catheters that are called peripherally inserted central catheters that come in through the arm and end up right there next to the atria, where medications can be given. In other cases, they may also have tubes that are introduced into the nose, into the stomach area for feeding, and other patients may have a long-term indwelling catheter into the bladder itself. These also become problematic as they are sites for infection, and they may also become dislodged or obstructed. What we really want to take away from this point now is that usually it's the caregivers that are very knowledgeable about the events and the situation or circumstances surrounding the medical conditions of their patient. They also would have had some instruction on how to maintain these devices at home. So defer back to them and use them as part of your team. Now, the last few devices are a lot more technological, and I don't have any here, but there are devices that connect directly up to the myocardium, and it's almost like a catapropulsion system that allows the heart to rest and convalesce while this device pumps the blood throughout the system. It's called an LVAD, left ventricular assist device. Basically, it's a battery-powered catapropulsion system that has the blood flowing through the system but doesn't allow for that lub-dub sound as the heartbeat, boom, 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 boom. It's a continuous flow. These have backup power systems. They also have electrical AC current so that they can plug in, and then conversion systems from DC to AC conversion, so if they are traveling there to take these devices. Again, these patients that have these devices have a number to call to the clinical facility or the specialty center that's monitoring these patients. They have a lot of checks and evaluations to do on the machine. We need to make sure that we take this with us. In the case with the LVAD, this may not cause the heart to make any sounds, and therefore we may not be able to feel an palpable pulse. This may also mean that we may not hear the closures of those heart valves, so it may not leave us any sounds to hear. More importantly, it is basically causing the blood flow throughout the body without the mechanisms of the heart or the electrical conduction system of the heart. So when we put the EKG on, we may see something other than a sinus rhythm, but the person has a good skin signs, very good cognitive output, and they're able to communicate with us clearly, and we may not be able to get a good blood pressure. So for example, if we were to put the monitor on and all of a sudden we saw something like a really slow bradycardic rhythm, or in another extreme case we saw ventricular tachycardia, this may mean that the heart might be doing something different as in a comparison to what the machine is doing. All right, so please review your chapter on special needs patients.